Hello, welcome back. I'm Bill Hill, and thanks for joining me on our continued series about how health insurance companies make money. If you remember from our last video, we actually broke down the three separate components of a group health insurance contract. The largest section is claims. The next largest section would be administration costs, and then the final and smallest section would be the reserves. Today we're going to talk about the administration costs and explain the different components or sections of that. As you can see, my board here is overly prepared. I got a little long-winded, so we're just going to cut it down to the bar chart here to keep it short. In this section, I'm going to talk about the 20% that the companies can keep. But just so you know, in 2012, when the Affordable Care Act passed, the law actually stated that insurance companies could only keep 20% for admin on groups under 50. For groups over 50, they can only keep 15%. So after I go through this, you're going to see that it's not only is it difficult to make money under 20%, but it's even more difficult to make it at 15%. The first section of the administration, or the first component of the administration I wanted to illustrate here, I've got listed at 9%. This is for the operating cost. Now this is almost half of the total that they can keep. And keep in mind that as I'm talking about these numbers, they fluctuate. They could be plus or minus two or 3 points. It just depends on the area of the country and the insurance company. But the operating expenses are going to cover things like staff, utilities, buildings, marketing, goodwill, where they give money to the community, local community that they serve. The largest section of that, though, or largest piece of that, is going to be stop-loss insurance. And this is insurance that the insurance companies actually buy to help protect them against large losses. Because remember, in this model, you're paying the insurance company to take away your risk. So they assume all the risk whenever you buy a contract from them. So a stop-loss policy basically says that if there's a large unexpected claim, and generally it has to exceed a certain level, $25,000 or $50,000, that the stop-loss insurance company is going to reimburse the health insurance company for that claim in excess of that amount, that stated amount. Think of it like a large deductible. The next largest component of that is going to be consultants or brokers, agents. And consultants are basically the hired hands. They're the ones who go out and present the material to the employers, convince them to take one path or another, one policy or another, and then help them implement that policy and basically help them with administration if there's some things that go wrong during the plan year. There really is no local agent that you can call that works for the insurance company to come out and help you. So people like myself approach employers, and then we help them make those choices. That is going to be about 5% of what the administration is. So, and it fluctuates, but plus or minus 2%. The next largest section is insurance company sales staff. Now this is going to include people that are actual salespeople, people who work in renewals, renewing existing cases. It's going to include underwriters. All of those people are responsible for bringing in new business and retaining business. So you have to pay them as well. That only leaves about 3% for the health insurance company to make its profit. Now guess what? If they make a mistake and their expenses are too much, they lose money. If they charge too much in claims or administration, they have to give money back. So this is a really tight margin to have to make profit on. It's even further complicated for groups that are over 50 lives, because over 50 lives, they can only keep 15%. Now I ask you, where are they going to get 5% here? Because this is pretty lean as it is. And what I'm contending and what I'm going to illustrate a little more in depth next video is that they're not making money on the administration. It's almost impossible. So I hope you'll join me next time. We're going to go through the rest of the board back here and get into how quickly an error in calculation can help the insurance company lose money.